Welcome. I appreciate everybody coming today. I'll just start off by introducing myself. I'm Sean Churchill. I'm the Managing Director of Cultivate MD Capital Funds. I'm an orthopedic surgeon. I had a shoulder reconstruction practice for 21 years outside Milwaukee. Around 2017, my partners and I formed Cultivate MD Capital Funds as a venture capital fund on early stage medical. We've had a total of 4 funds at this point, and due to the success and my thrill of this, about 2.5 years ago, I decided to retire from my orthopedic practice and move back home to Colorado. And so I do this full time now, and I love every minute of it. I've got 2 partners up here I'd like to introduce you. These are managing partners of Cultivate Funds. They are heavily integrated into our largest portfolio company, Shoulder Innovations. Rob Ball will get to in a minute as the CEO of Shoulder Innovations, but first I'd like to introduce Dave Blue and Matt Ahearn. Dave Blue is the Chief Experience Officer, Customer Experience Officer for Shoulder Innovations, and Matt is the COO for Shoulder Innovations.
Well, good morning. It's great to be here. As Scott said, we actually had planned to talk about this story because this really says a lot about Scott and the LSI conference. I mean, it's very real. But 4 years ago, we were all here. I mean, Matt and I were presenting, and we each had 4.5 minutes, totaling 9 minutes for the fast pitch, right, that you see here that happens. And sometimes you come into those and you're like, it's just not enough time. You don't have enough time to talk about what we really want to talk about. But we get done with this pitch, and you remember this really well, very much, Matt. Yeah. And we walk off the stage, and to what Scott just mentioned, there's a distinguished gentleman waiting for us at the end of the steps. And you get this finger that's doing this. And it's like, unfortunately, he's not doing something else with his finger. He was basically encouraging us to come. And later we learn this is Jonathan Root. And when Jonathan Root summons you to come to one of the one-on-one rooms to be able to meet, that meeting went so amazingly well. That was the beginning of our journey to $22 million that was closed shortly after that. That came from this conference. That came from this network. So sometimes when you come here and you think, oh my gosh, it's time, it's money, this is a powerful network here. And you got to be able to take advantage of that. And you're going to get to experience what has come from us through this. And all of these are LSI alumni as well. I mean, it's kind of an amazing story. When Scott reached out and said, we want you to come and be a part of this panel, we want to show off this talent is what the whole purpose of this is. So anyway, Matt, we do some heavy lifting in our organizations, but I carry this Chief Customer Experience Officer role that's really engaged in Shoulder Innovations. It's one of our most mature companies. It's doing incredibly well. So we fast forward 4 years, it's like a rocket ship. And that's not to brag. That's just to be encouraged to some of you that are coming for your first time that there's a lot of excitement that can come from this conference.
Yeah, and I'll just, I say this reminds, flashbacks to, 2020 of practicing that 9-minute speech 700 times, and coming in at 9:02 and doing it again. So the clock that we see here facing us is a little bit stressful, but, the story that Dave shared and Rob will share, a tremendous amount more of, 2020, John Root, U.S. Venture Partners leading around. It set the basis for the momentum that's being built today, and, just the tremendous growth and momentum and the areas that, just we think about Shoulder Innovations 2020 to where it is here in 2024. So, there's, as we talk today, you'll see the momentum of the portfolio, and that, we wish and we hope and we're here to support the portfolio to see the types of momentum that Shoulder Innovations is experiencing today. So with that, I'll turn it back over to Sean.
Thank you, Matt. So let's just run through the panel here real quick. We told each of our portfolio companies to come up and present ourselves. There's 3 who couldn't be here with us today, but because the stage wouldn't fit us. But we'll start with Rob Ball, CEO of Shoulder Innovations.
Hi, Rob Ball, CEO of Shoulder Innovations. Thanks for taking the time today. Of course, I presented yesterday. Shoulder Innovations is a later stage venture-backed medical device company today, focused a pure play shoulder arthroplasty company. Our team's been working on shoulder arthroplasty for a couple decades now, so perhaps have threaded the needle on the perfect shoulder implant, despite some people on the stage that may disagree. But at any rate, we've as I said, we raised a Series C in 2020. Coming out of this meeting, we just raised a Series D, $42 million, led by Gilda Healthcare, about this time last year, and we're able to raise some additional $45 million in debt last year. So we've been able to layer in quite a bit of capital. We've grown a ton. I think when we were first here, I think we're probably still in the hundreds of thousands of revenue. We'll run about $35 million this year in revenue, and so we're in a lot different spot than we were 4 years ago, and it's been great to see that progress. So thanks for attending today.
Excellent. Thank you for that, Rob. And now why don't we just moving to the left here, Nathan Estruth, the CEO of Genesis Software Innovations.
Hi, I'm Nathan Estruth. I'm chairman of the Cultivate MD Funds Advisory Board, and I'm here as Sean said, as chairman of one of our companies, Genesis Software Innovations, doing business as Provoyance at provoyance.com. In 45 seconds or less, what is Provoyance up to? We take healthcare images of many kinds and transform them with surgeon-informed AI into highly usable, really superior 3D gamified imaging for healthcare professionals. And we do that via surgical planning software. We also do it via scanning, 3D scanning from smartphones, and we can also embed those kind of images and that transformation into virtual clinic platforms. Last but not least, we were the first to have software approved through FDA in the MSK category that FDA created on AI/ML. So we're very proud of that, and we'll talk more about that in a minute.
Yeah, excellent. Thank you for that, Nathan. To Nathan's left, your right is Julius Heil, the CEO of SPDx.
Yes, Julius Heil, CEO of SPDx. We are a sterile processing business that processes all medical instruments, specializing in orthopedic trays across an entire market. We're completely agnostic, and we actually create value within the marketplace rather than shift value from player to player. The interesting thing about sterilization is it becomes a huge constraint for the ASC markets and also as a backup for the hospital. When sterilizers go down, capacity is lost and patients don't get treated. What Sterile Processing Express does is ultimately we do provide sterile storage, which increases asset utilization for the joint manufacturers and the implant manufacturers. And we provide sterilization capacity, pickup, logistics, and information services for the ASCs to grow revenue. So basically, as the healthcare ecosystem grows without the network infrastructure that we provide, it severely constrains that. So we remove that constraint from the markets we choose to enter. Thank you.
Yeah, excellent. Thank you for that, Julius. And to the left, Karen Holzberger, the CEO of SpintechMRI.
Hi, everybody. I'm Karen Holzberger again. Thank you for having me and all of us here. Our software platform called Stage is a software platform that gives time back to the health systems by reducing the scan time. So one of the big issues today in health systems that they're facing are backlogs in MRI. We create time, which creates revenue streams without compromising the image clarity for the radiologist. We really solve that trade-off that the health systems are seeing today. And so it's really exciting for us with one of our partnerships with Yale, New Haven, around clinical collaboration to really prove out the operational efficiencies that we provide in their current fleet of magnets, as well as some of the work that we're doing with some of the OEMs around their AI strategies, where we really fit in to augment their AI strategies. So thank you again.
Yeah, thank you, Karen. And to Karen's left is a fellow physician, Dr. Michael Gardner, the CEO of Nsite.
Thanks, Sean. So Mike Gardner, co-founder and CEO of Nsite Medical, an orthopedic surgeon at Stanford University, and first got to know the Cultivate MD team about 6 years ago, actually as an investor in one of the early funds. And then a year later, about 5 years ago, my co-founder and I identified some really significant problems in treating and diagnosing scoliosis. A major one is accuracy of diagnosis, as well as access. So we set off to develop some software that could very accurately and remotely, using 3D scanning and kind of AI-enabled, assess scoliosis. And so we've kind of come through FDA clearance, and we're using that to kind of power additional services that scoliosis patients need under the National Scoliosis Clinic brand.
Yeah, thank you, Mike. And Andy Iott, CEO of HAPPE Spine.
Yeah, thank you. Here as the CEO of HAPPE Spine. HAPPE is a medical device early stage company focused on orthopedic implants. We want to improve clinical outcomes with our proprietary biomaterial platform. The name says it all. HAPPE stands for hydroxyapatite porous peak, which we believe is a significant leap forward in the ability of the material to improve fusion rates and lower complications, particularly in spinal cases. It is a platform technology, and we have multiple products that we believe can benefit from this technology. Myself, I'm been in medical device for 25 plus years. I was a co-founder at Globus Medical and ran product development for them. And I'm happy to have joined the team at HAPPE in the last 2 years.
No pun intended.
Yeah, happy.
Thank you for that, Andy. And then Berk Tas, the CEO of SentiAR.
Thank you, Sean. It's so nice to be with these esteemed panelists here. A little intimidating, the brain power. Following HAPPE, I wish our name was something a little more like Smiley Guide or something like that, but we're going to have to go with SentiAR. We developed world's first holographic guidance system for cardiac ablation surgeries. So the company's foundation about 6-7 years ago came from a practicing electrophysiologist who would perform these procedures on kids. He's a pediatric electrophysiologist. And the need for her was so obvious and immediate that she had no choice but to start a company. And that's how we began. Now it's in clinical use. We've actually gotten FDA approval for this product. It's provided through augmented reality glasses. And it allows the physicians, the operating physicians, to see the heart they're operating in. It's a closed chest surgery, minimally invasive. They're able to see the heart in true 3D hologram in real time with the catheters and other tools inside, all in real time. And they're able to manipulate this image that they're seeing in real time through a hands-free control mechanism. And they do it all through glasses. This is where everybody goes, ah. Thank you anyway. Look forward to the rest of the panel. Thank you.
Yeah, thank you, Berk. I will say we have 3 portfolio companies who are also LSI alumni who couldn't be here. No stranger to the stage is John Murphy, the CEO of Virtual Incision Corporation. For those of you who have not followed Virtual Incision, they have miniaturized the robotic world from a large 2-ton mainframe computer module that has to sit in a single operating room to a 2-pound intra-abdominal robot that can be portable to every operating room. So every operating room becomes a robotic room. John's been, had tremendous success here. His company is FDA approved now. And for those of you who followed the space program, approximately a month ago, they sent the robot up to the space station and actually did a simulated remote operation up on the space station with our surgeons down here on Earth. It was quite fascinating. But John's been a tremendous company to have in our portfolio. And we're happy to have partnered with him over the past 6 or 8 years. Also, Nanocon, Ben Holmes is the CEO of Nanocon. Nanocon is directing their efforts at solving the focal cartilaginous defects in the knee. These focal defects oftentimes go on to, in young individuals, to develop arthritic changes. They have a novel implant that actually works as a scaffold for cartilaginous ingrowth. We partner with Ben to help develop the deployment system as well as work as an investor and on the board for Nanocon. Ben's been here. Unfortunately, he couldn't make it this year, but they have their first in humans planned for later this year, possibly as early as Q3, but probably in Q4. So they are making tremendous headway moving forward with this. And last is Stratos. It's a pulmonary company. The CEO is Nick Delmonico. Nick's been up on the stage several times as well. And they have a pulmonary monitoring system that's about half as thick as a hockey puck and is adherent to a person's chest wall. So remotely, the physicians can monitor breath sounds, cough, wheeze, and they can do this. And Nick's really threaded the needle on his device and found tremendous success in the pharmacological industry, where these pharmacological companies are trying to get new products on the market and cleared through the FDA. So they do huge patient trials, and these patients oftentimes have to blow into a wheeze monitor and all this thing that requires effort, and the patients get tired of this and they lose effort. But this is a total passive system that is adherent to their chest wall, so the patients enrolled in the study don't have to really do anything to participate other than wear it. So Nick could not be with us today as well. Lastly, it's somewhat bittersweet. Our exit last year was Embody with Jeff Conroy. Jeff Conroy has commanded this stage several years in a row. His company was developing a collagen scaffold to work on soft tissue augmentation and repairs. We coupled with them, Rob Ball was on the board there, we coupled with them to help develop a deployment system. They had a wonderful exit. Two of our funds invested in Embody. They had a wonderful exit to Zimmer Biomet last year for $275 million. So although we wish he was here, we're glad he's not here because it was a great exit for all of us. So at that, I'll turn it over to Matt and Dave.
Yeah. Thanks, Sean. Well, we're going to ask some questions of the panel and get some interaction going with them as well. But I want to pick up with you, Nathan. What from your introduction, you were talking about just our network and how we might work with various areas with ProVoyance. Mm-hmm. Can you share some examples of that and how we cross-pollinate between the companies and how there might be an opportunity there?
Sure. I just say the best way to talk about the cultivate difference in terms of the ecosystem that they have for me is to contrast it with when I was at before I was with Cultivate, I was at Procter & Gamble, and for the last decade of my career there, I led their global new business development group. And so I spent a fair amount of time in the VC and PE world representing a large company. And the first larger meeting that I went to with my wife at Cultivate as investors, she took me aside afterwards and said, why do you spend your time with anyone else but those guys? And honestly, it's a foundation of trust and humility that I find not only within the Cultivate LP community and the GPs, but across the portfolio companies. And so at ProVoyance, we consider it a part of our mission to make sure that we're bringing the best tools that we can to other companies. And I think, Mike and Rob are two great examples of that at Nsite and Shoulder Innovations, respectively. And there's a level of trust where they make us better because they're open book, and we can then delight them more, right, as our customers, and it allows us to then delight customers that aren't within the Cultivate universe as well. Yeah. So I don't know, Mike, I'll maybe toss it to you and then back to Rob on how has ProVoyance helped you as you've thought about your Nsite journey and the broader ecosystem?
Yeah, thanks. Great. So, first investor in us was Cultivate. So we were really starting from scratch. And we needed a lot of resources that go into a full-fledgling startup. But first and foremost, we needed to figure out as a technology company that we were aspiring to be, how we were going to do that. And further, as I've learned kind of along the way and later, an FDA cleared software device it's hard to do. It's hard to build a team internally that knows how to do that. And so not really realizing going into it how critical it would be for us to have a software team like ProVoyance, now GSI at the time, who had expertise and a track record with success of doing that was really critical to where we are today. So we had kind of a ready-made team, again, with experience, and we had a vision of what we wanted it to look like, but the process of bringing that through the FDA is complex, and I had no idea what it was going to take, but it made us kind of launch into that next level of kind of now an FDA cleared technology company.
And I'll just characterize, I'm on the board with Mike at Nsite, and I've learned a lot watching Mike pivot the business a number of times as you navigate that FDA process, and indeed, as CEO of Shoulder Innovations, observing various ways he creates value in a completely separate business. But I've learned a lot in terms of considering how can Shoulder Innovations create more value by watching Nsite do that. So, and it's been a neat experience.
Yeah, so this next question would be for Julius, Karen, and Andy. So when you think about the Cultivate MD limited partners, we've got about 150 limited partners across our 4 funds. About 60% of those are doctors. And so we have this incredible built-in network of knowledge and experience. So a question for Julius, Karen, and Andy would be, kind of how have you leveraged, individuals, LPs, to help, resolve a problem, grow the business, make a connection. And then also when you consider the advisory board led by Nathan, how you've leveraged them as well in that same context. So Julius, we'll start with you.
Yeah, under the premise that it's impossible for any one of us to be as smart as all of us. I think that's the culture that you experience up here. This group is incredibly open, and as we look to grow our business, whether it's building a network, whether it's looking and finding someone that's faced a particular challenge at the size that you're at, because solving that problem, if you're much larger, could be simpler but much more expensive. This group, and having access to everyone standing up here and a host of others across the board, I have yet to find anything that one of us hasn't faced. And so that stops a lot of the trials and tribulations, the landing in the pitfalls and falling in the holes. You just call, you talk to them, and everybody is so open with the information, and they'll tell you everything that they know, that I really enjoy being a part of this family.
That's wonderful. I think to augment to that is the fund, and especially with the partnership that I have with Matt, is that it allows you to play to your strengths. So I'm a commercial CEO. I came in at Series A, so not a founder, not a co-founder, but coming in to take from minimal viable product to minimal viable traction. I was in the corporate world working for Nuance that was sold to Microsoft for $19 billion. And so I have a very different experience and a very different set of strengths. But to balance that off in a trusted, transparent partnership with somebody like Matt and the Cultivate family, whether it's them as board members or within the LPs themselves, to be able to leverage that. Because that's the best of what you want at a stage of company that specifically that we're at, is how do you take 1 + 1, not just equal 3, but get to 5 as fast as you can. And I think that's what's really important, is that they let you work to your strengths and then fill in where you need help, because they've just seen the cycles of it. You can see here the different, I'm going to use my product name, stages of the company, but they can help kind of see things before you see it. And I think that's just really important.
Yeah, that's great. Coming in late to the group at HAPPE, I got to see how much the Cultivate and the Genesis team provided resources to take what was essentially a science project and create an actual FDA-cleared commercializable product, both from a finance perspective, from product development, a quality system. Michelle Ball has done great work getting us through our audits and being ISO certified. Even one of the LPs has a manufacturing facility that we utilize. So without really the partnership with Cultivate, I'm not sure where HAPPE would be, and it's just been a tremendous partnership, as I can tell.
Great. Yeah, thank you. So another question, and this one's for Rob, is, in the early days, rewind back to 2017, 2018 timeframe, Cultivate Funds was the largest shareholder in Shoulder Innovations, and there's been a tremendous amount of growth, as Rob and Dave described, 2020 forward. So the investment, the board has shifted, away from a Cultivate domination, for lack of better terms, now to 3 large venture capital firms, observers, just a much different set. Rob, talk about that transition and how Cultivate has continued to remain involved, but just also the trajectory that the business is on and how that's changed.
Yeah, I mean, you definitely, you cannot sell your way out of a cash flow problem, right? So you do find yourself that, growing businesses just become thirstier and thirstier for cash. And, that we found ourselves, Cultivate being a relatively small fund, found ourselves in a circumstance where Cultivate could no longer, kind of continue to fund that growth. So, obviously we sought capital in other sources, but the advantage with Cultivate continuing to be very engaged is that, the level of operational engagement of Cultivate provides them with really very, very unique practical access to what's actually happening on the ground in the business, which provides a dramatically different risk-reward profile. When you know everything about the business, it's pretty easy to know when and when not to write a check, if that makes sense. And so Cultivate was able to lean in fact, like many of you, as we experienced, kind of dramatic thirst for capital contrasted with a paucity of capital available in the market over the past, call it 3 years. Cultivate was really able to lean in harder, even much harder than some of the larger investors on the cap table, because of that granular understanding of the business. So it does provide a really unique circumstance to support those really kind of difficult circumstances sometimes.
Thank you.
That's good. So Berk, question for you on, you think about our relationship and how it started, and think about maybe the journey it went through. I would love for you to share with this audience what that pathway was, because it was very meaningful to us.
Yes, and meaningful to us as well. So I got a chance to meet Sean first over an email introduction from one of our advisors. And at the time, we were looking at a written deal already. We had a lead, and we had majority of funds already secured, not in the bank, but committed. And as they were evaluating and about to come on, it felt like there was good momentum. We had a parting of ways with our lead. And I called Sean, a call that I never, ever wanted to make. And I don't think it will get easier, probably. But I said, look, here's the situation. There's some games being played, and we don't want to be a part of this anymore. I'm going to walk away. Are you guys still interested? And it's hard to communicate that conversation here, because when you've been at this for as long as we had, and there's success and customers want it, you're dealing with a situation that is out of your control. And Sean, without a doubt, he goes, "We got you." I mean, that's all he had to say, right? And you fast forward to where we are now, he really do have us, right? That he didn't just, they didn't just write a check, but Sean has been with us in our animal labs, and he's a physician. He thinks he was just doing this amazing job in the animal, and turns out animal was dead. So, he's also getting his little black eyes here and there too. But, I think from our perspective, the clarity and the concise and unwavering support that we received from Cultivate has been game-changing for us, right? You go from looking at one scenario to a completely different, full flip scenario. And then on top of that, you heard from these guys, they're all operators. You got a physician and an operator. A very different capital source when you're in our seat. When I need something, I'm like, I wonder how David has done this before. I can do that, right? I'm like, hey, Sean, can you ask Rob how he would deal with something like this? He's running a whatever, $35 million revenue company. We don't. So obviously he's been through some stuff. So I think from my view, the partnership is beyond the capital, and it's one that's built on trust more than anything else. And in the end, we're all developing amazing technologies, but we're all people, right? And I have a group of people I'm responsible for, and they got families. So that side is not lost in this relationship, and that's what I appreciate the most.
I'm not going to let that go uncommented on. So in my defense, that pig had been on the table for 8 hours. And when I'll tell you, when Berk holds a lab, Berk holds a lab. He had, I think, 3 or 4 strategics there that day, 3 or 4 physicians. These are top-level electrophysiologists from around the country who came to that lab. And everybody who's in there, I'm taking my notes diligently and sit in the background. And when I got done, I'm an orthopedic surgeon. I've been doing arthroscopy for 30 years. I mean, how hard can this be? It's a video game. How hard can this be? So I got on there, and I'll admit I struggled a bit at the beginning, and then it became very, very easy. And I was so proud of myself how well I could direct it, how I could do this, I could do that, I could do everything they asked me to. And I got off, and Berk understood the delicate, the ego of a surgeon. And he said, well, Sean, you know the pig died like 10 minutes ago. So I didn't, but he handled that really well. So.
That was a good time. It was a good lab.
So one of the things that Karen had hit on in her previous answer, and this will go to Julius and to Andy again, and as well as Karen, and then the alternative side for Mike Gardner is when you join an early stage business coming out of a larger business. So Karen talked about leading a $200 million business at Nuance that got acquired by Microsoft. That stresses, the strains, the challenges, what you wake up on Monday mornings and you think about, and what you wake up on Saturday evenings at 3 o'clock in the morning, and what you think about are very different than your previous role. So, talk about your experiences, the 3 of you, and then Mike, talk about it from your experience as a surgeon entering in entrepreneurship and as a CEO, the stresses, the strains, the challenges, and how you've been able to lean on the network and cultivate to, kind of navigate through some of those things. So I want to start with Andy.
Sure. Yeah, there's pros and cons, right? Coming from a big company where you have a marketing department and a travel department, and there's resources that are in abundance that you can take advantage of. Coming to more of a startup where you're wearing lots of hats and you're have a lot of responsibility, and it's nice to have a group that you can go to and say, hey, I need help with this, or here's a question. Guys, have you faced this before? And so it's nice to have that kind of rope, if you will, that you can lean on. And it's not like you're just out there on your own. We have a small team. We're trying to be capital efficient. So it's nice to have some free advice and some free input, so to speak, and it's been great.
Mike, do you want to go just from the surgeon perspective?
Sure, yeah, thanks. So coming from the exact opposite direction, orthopedic trauma surgeon, so I'd kind of gotten used to what I thought was fast-paced environment, which was nothing compared to starting a company. But I think I had a pretty good sense of a clinical problem, had a vision for a solution that we thought would work, and was passionate to really go all in to do this. But that was it. And come to find out, there's really a lot more that goes into starting a company, the foundation of a true business. And so, things changing every day, but little things I look back and remember, like, Rob, we're about to hire our first person. Like, how do we do that? Oh, we got an HR team for you. Here you go. Let's set that up. We're ready to go to the FDA. We need an FDA advisor. Yeah, here you go. Yeah. And so little things and then the next day something else happens. So kind of lose sight of that. But there's been so many things along the way that have just been instrumental in setting it up. And then as far as, even harder to quantify and remember the direct value from, but all the people introductions along the way that you don't see the value when it happens, but it opens 3 doors, and those things open 3 doors. And so it's really been an unbelievable kind of evolution, thinking back to when we kind of started to where things are now.
That's great. That's really, to kind of add on to that answer, is really, Matt has got a great analogy about bowling. I don't bowl, but you got just knock one pin down and have the rest of the pins come down. I'm not going to get the analogy correct, but really focusing on that first pin, that second pin. I think in corporate world, you're thinking about your multi-year plan and what 3 years look like, but when you're in a Series A startup and getting through minimum viable traction, what are the two critical things, or the one critical thing, in this case, probably the bowling ball and the pin, is to get it down the thank you. Alley. Of those critical things. Because you can get lost between, I think, the trees and the forest because of running large global businesses about like what are the first 3 things you have to get done, and from those 3 things, what are the next 6 things that you have to get done, and really building and that doubling that you have to continue to do. And that's been really helpful with just that reset again of going back of how do you play to strengths? How do you know your strengths? The partners know their strengths, and how do you kind of marry that together? And I think that's really important. That's just been a really good lesson for me throughout this journey.
Yeah. Well, I tell you, the piece I love about this group is the humility. I mean, we have a culture here at Cultivate that we hope is that same kind of, we're eager to learn. We don't have all the answers, but together we're stronger than we are individually. And I think you're seeing that, and that's what we try to cross-pollinate between our organizations. But Sean, maybe you can share an example of what, I'm thinking of Embody, the changing the trajectory when we came in and kind of worked with Jeff early on. Maybe you can share that story, because I think that's just another amazing situation that happened.
Yeah, sure. So it's 2018, and I'm practicing orthopedic surgeon. I get a call. I think I was still in the office that day, and Matt and Dave had just left a pitch session in Chicago, and they said, hey, Sean, we got this company. It's got a really strong CEO, Jeff Conroy. They make some kind of, I don't know, tissue type thing that's supposed to help tendon repair. Would you look at it? And I told him at that point, I said, listen, as an orthopedic surgeon, I've been down this road too many times. These things, they cause a biologic response with the host. They don't work that well. They're often rejected. I'll look at it, but don't hold your breath. And so I got the information. I looked at it, and I like the studies that have been done. I like the IP stuff. I pulled Rob in, and Rob and I really dug into the IP, and it looked really good. It looked very, very promising. And so I told the guys, I said, someone at some point is going to split the atom here, and this may be it, because I really like this stuff. So let's do this. Let's go down this road. So we met with Jeff Conroy, and we're talking to Jeff, and we were speaking with him, and Jeff is just the master of as a CEO. And so we were questioning. We said, well, what's the plan? And he says, well, what we're going to do is we're going to go after the Achilles tendon market. And we said, well, Jeff, why the Achilles tendon? And he said, well, it's this tendon right here, down here by your ankle, below the. No, Jeff, I'm good with where the Achilles is at. I understand that one. I'm good with that one. Thank you. But why that? Because there's 30 times more rotator cuff repairs than there are Achilles repairs, and that's a real number in the literature. Why are you going after the Achilles? And he says, well, it's an open procedure, and the shoulder is an arthroscopic procedure. We have no way to get the device into the shoulder. And so our group partnered, and we said, well, hey, we have some partnerships that can help you out with this to help develop a deployment system with that, and they could do the job for you. So we felt much more comfortable investing as Cultivate, knowing that this company was going to be developing this deployment system. Jeff was super happy. Rob got on the board. It was a wonderful relationship. And in the end, we had, as I said, 2 of our funds invested 4 different times at various valuations and had a great return. But to cap the story off, I don't know if I've even told you guys this, but to cap this story off, last summer I was at an orthopedic meeting, and one of the presidents of a very prominent large orthopedic company came to me and said, hey, Dr. Churchill, congratulations on Embody. And I said, oh yeah, thanks a lot. And he said, man, we really wanted that. Zimmer just outbid us, but we really, really wanted that. And I said, oh, that's great. So I'm just curious, the original thought was going after the Achilles market and then eventually getting to the shoulder, but if the shoulder thing hadn't been involved, it went for $275. What do you think it would have gone for? Yeah, maybe 70. So that was the value. And that was when I really just, my eyes opened up. I said, 70? He said, yeah, the shoulder market's where it's at, not the Achilles market. We maybe would have gone to 70 rather than 275. So that was a big moment.
That's good. Thanks for sharing that. Well, if nothing else, we wanted to be able to share the power of a network, the network of LSI, the network of what's happening between our portfolio companies that Cultivate. Feel free to reach out, grab any of these CEOs, get some time with them. They all have opportunities to connect with you, just like Matt and I did with Jonathan Root. But this is really a pleasure. Thank you for giving us this opportunity, and we really appreciate your time.
Thank you.